Our pets can't tell us what's wrong, so we have to work to figure out what's going on for them, and advanced imaging really gives us that capability.
The way that we're successful in understanding what's happening inside a patient is one, with the imaging, and then two, pairing that imaging with experts that understand what that imaging is telling us, and those are the radiologists that we work with every day.
What's unique about CSU is the breadth of specialists that are here and the equipment that we have available. We do offer all modalities for small animal imaging that you could find, in a human hospital. Radiographs, ultrasound, CT, MRI, PET CT. In radiology, we have a couple of X-ray suites for standard radiographs, and then we also have ultrasound machines for abdominal ultrasound, but also could be thorax or other body regions.
The new CT scanner that we have at CSU has really been a game changer. I liken it to what it might have been like with black and white television when it came to color, or even now high definition television. Because before, an X-ray or even an ultrasound gives us a two-dimensional picture of what this CT allows us to do is to take three-dimensional pictures, to recreate them in any way, to take that three-dimensional data and then print it into an actual real-life model of a patient's heart. And that is something that we can then do and understand exactly what's happening inside the structures of the heart, to plan the surgery very precisely, to show the family what's going on in their dog, and to practice a technique in the actual patient's anatomy before we go do the procedure in the patient.
My name is Stephanie McGrath, and I'm an associate professor in clinical sciences, and specifically in neurology and neurosurgery. Imaging, specifically MRI in neurology, is the most useful diagnostic tool that we have for diagnosing brain disorders, brain diseases, spinal cord disease, and it helps guide our conversations about prognosis and treatment plans. It's one of the only methods for really looking inside the brain and spinal cord. All other diagnostic tests are very limited in that capability, so the MRI is kind of the full package. It gives us everything that we need to know to understand what may be happening in an area of interest.
My little old man, 10 years old.
I know, I can't believe it.
My name is Jenna Burton. I'm an associate professor here in medical oncology, and I am also the oncology service chief and section leader. Imaging is everything. To understand where the extent of cancer is in the bodies of our patients, imaging like PET CT are really crucial for us to look for areas that cancer might be. It's a form of a CT scan where we get images of the whole body, and what we're looking for, the added bonus with a PET CT, is that we inject a medication that is uptaken by rapidly dividing cells. Those areas will light up on the imaging, and so it helps us identify areas of concern or eliminate areas of concern.
Good job.
The imaging opportunities at Colorado State are unique in veterinary medicine.
We often are very similar to top-of-the-line human hospitals. It's pretty uncommon that a patient just has one diagnosis, and sometimes there's other problems that we need to manage. And the beautiful thing about being at CSU is that we have these world-class colleagues in all the different specialties, because a patient isn't just a diagnosis, they're a patient and a pet. And so here we're able to provide all the things that that patient needs to make sure that we have the best outcome possible.
What a good boy. Oh, is that camera so delicious? Delicious. Oh, it's so delicious. Wow, I don't want your puppy kissy.